So, Dr. Bharat, the next question is on ARDS guidelines, which we are bringing out this year. So, can you share your insights about this new ARDS guidelines we are developing and highlight the key updates compared to the previous versions and explain the little bit of anticipated impact which it will have on the clinical practice?
Dr. Monalisa, if you ask me what is the best thing has happened as a general secretary in the society, I would suggest these guidelines because it's been a very good learning experience, and this is the first time ISCCM is coming up with the guidelines. We have issued guidelines, and I have also been part of previous guidelines as well. I co-chair the NIV guidelines, I chair the DBT guidelines, but the methodology what we are following in this is the really robust. So we have the search methodologists, professional one, which are part of it. So initially we had a meeting amongst the team, which guideline needs to be reviewed. So we discussed, we cut down on the 5 guidelines. Then we had the search, we had the international expert, Professor Bram Roshak, which been helping us out with this, the methodology. We have the professional search methodologist. Search will be reviewed by the someone. Then again, we designed the PICO questions. So it's been the total robust methodology which has been formulated. And recently also we had the comment from the Bram Roshak. He said even the best of the guidelines don't follow this kind of a strict and stringent methodology process. So ARDS is one of those guidelines, and I am chairing that ARDS guideline overall section. So we have certain parameters, like if you know low tidal volume, we don't have to beat that and reinvent the same wheel again. So we decided not to write the whole guideline as a whole. So we came down to the certain PICO questions which are not been addressed or where the new studies have come in. So of course the first one is on the driving pressure. So we will be commenting on the driving pressure, and then steroid use. Because there's an ambiguity, there are certain areas which says could be used, there are certain areas which could be said no, again the dose and when to use it. And also ISCCM is coming up with the first RCT, which is again on the steroids in the ARDS. It's being led by Dr. Sheila Mehta and Dr. Sumitre. So they are also coming up with this, and this is why we thought of including this question over there. And of course the fluid strategies in the ARDS. We all know neuromuscular blocking agent, the ISCCM has issued a statement, but sedation, when to use it, how much to use it, what to use it, also we are coming into it. And we'll also address the phenotype question over there. So we will not come with the overall thing. We'll come with the preamble saying we follow certain gold standard strategies. We will not comment on those, but there's areas where there have been newer studies available or the ambiguity is there. We'll address those areas, and it will be an interesting paper to see.
Thank you for answering that question.